I'd just like to briefly introduce Danielle, who's going to be our moderator, and then I will get off the stage. Danielle Bryan is known to many of us. She's the executive director of the Project on Government Oversight. She's also a member of the Freedom of Information Act Hall of Fame and has been ranked 3 times in Ethisphere magazine as one of the top 100 most influential people in business ethics. I am so honored to have her here. If you want to go to the Project on Government Oversight website as soon as you get out of here, because they are doing such great work in addressing these issues, not only on crony capitalism, but every major industry that has been paying for influence in this town, whether it's big pharma, big banking, big war, defense. These guys are on top of it. They've got incredible reports. I've worked with them for years in my own reporting. They are doing the yeoman's work in representing the American people and the taxpayers in this town. So I am just so proud to have her moderating this panel because she is all over it. And so I am going to get off the stage now and let her take over. But thank you, Danielle, for
Thank you
for
so
being
much,
here
Kelly.
today.
Wow, that was lovely. Thank you so much for that. This is just a fantastic panel for this conversation. I'm super excited about it. Just to make sure, I know you might have the brochures, but to be clear, so closest to the podium we have John Brownlee, a former U.S. attorney who was the person who had the groundbreaking prosecution against Purdue Pharma in 2007. Next to him, we have Chris McGreal, who's a Guardian reporter and also author of another book on the subject, The American Overdose, The Opioid Tragedy in 3 Acts. Then we have former Congresswoman Mary Bono, who is also on the board of the Community Anti-Drug Coalitions of America, and the opiate crisis has personally touched her. And of course, we know Tim, who we've just been hearing from. And actually, I want to also note, I love that you were pointing out about sort of phony nonprofits, because my nonprofit is, so to be transparent, POGO, the Project on Government Oversight, does not take any corporate, government, or union money for exactly the kinds of reasons you're talking about. This sort of something that you should look at when you're looking at any nonprofit is where are they getting their money from. It's just such an important part of the conversation. So you were referencing, Tim, for all of us, the undue influence of pharma, and you were talking about the lobbying influence and the revolving door and the phony nonprofits. And the name of this event is about crony capitalism. I like to think of it mostly as legalized corruption. I mean, I think we don't use the word corruption in America enough to describe things that actually are legal. John, of course, will be talking about things that are illegal, but so much of what we're talking about is actually, the swamp, how things work. But what I'd like us to do during this panel discussion is to talk about all the different ways that works, because we didn't quite get in those weeds yet. But also, I'm hoping we can leave with some ideas of what should be done to fix this problem, because as Kelly was saying, this is not just happening in this pharma sphere. This is how Washington works in many different sectors. So my first question is to each of you, what do you think is the most insidious problem? You've sort of said you think it's the revolving door.
Yep.
But I'd love to hear from the rest of you, what do you think is the most insidious problem that's really created the crony capitalism when it comes to this opiate crisis? Do you want to start, Mary?
Sure. First of all, thank you all for being here and for having me. It's a privilege and an honor. Also kind of tough to be next to Tim as a former member of Congress, but also a very important conversation. So I think that he spelled out some very good points, but I'd also like to say, as I was listening to him speak, part of my frustration right now is the demise of credible media, and that it's hard to find journalists who are really willing to do the deep dive and explain to the American people, look, when we were kids, we had Walter Cronkite, we had people we thought were credible, and they delivered the news to us. And nowadays, it's really hard to find that. So I think a lot of the problems, for example, the Moreno bill, it was never really explained carefully to the American people because this was already after, in my opinion, the demise of media. So it would help if those stories were actually told and explained to the American people in a great way. But the revolving door, I think it's hard to characterize every member of Congress in the same light. And I think it's hard to say that everybody's in there looking for a job after the fact. Excuse me, I've got a little cold. So I lost my election, and I certainly wasn't going, as I'm fighting for my political life, let me think about what I'm going to do next. And I actually had no idea what I would do after I lost. Luckily, I've been able to stay very busy in the opioid prevention, treatment, and recovery world. So in any event, I think he made some excellent points. I think it's bad to cast a broad brush, and I wish there was more responsible media still connecting with the American people.
Great. Chris, what do you think? What's the worst?
I think it's quite hard to put your finger on one thing. Good morning, by the way. I mean, obviously the big thing is money, but particularly with this epidemic, because it's kind of developed through stages. I mean, I think the influence you see right from the very beginning is how the pharmaceutical industry, in effect, wrote medical policy, and you see through the sheer scale of their operation, and partly because doctors in this country were very poorly trained in how to treat pain and how to use opioids, they were able to step into that vacuum, that void, and we can talk about it in a bit more detail later if you want, but they, in essence, wrote a good part of the policy that we have seen over the past 20 years, which opened the door to the mass prescribing of opioids. And so if there's one thing that happened, I think that's the most insidious thing that happened. And everything that followed from that, including the influence over agencies and Congress, in a sense was about creating inaction. It was about keeping that mass prescribing going. So they influenced, as Mary will explain to you, they influenced Congress to make sure Congress didn't do anything. It wasn't actually to get them to take actions. And they influenced prosecutors and the DEA and others to kind of minimize intervention by federal authorities. And so I think that really, for me, is the kind of pattern that unfolded.
John, what's your take?
Well, good morning, and Kelly and all, thank you so much for being here and for inviting me to be here. Let me give a little bit of a background so you can kind of get my perspective on these things. So in the United States, every state is broken up into several or one judicial districts. So the District of Columbia, although it's not a state, is one judicial district. The District of Maryland is one. My state of Virginia is two, has the eastern and western districts. And each district has one U.S. attorney who is appointed by the president and confirmed by the Senate. And that person's job is to be the top federal law enforcement official for that judicial district. So in my home state of Virginia, you have the East and the West. Now the Eastern District of Virginia, for the lawyers, is the sexy district. It has the rocket docket, it has the CIA, has the Pentagon, so you get a lot of neat spy cases. It has Richmond, so it's the center of our state's government, and so if there's corruption cases out of Richmond, that district will do it. It also has a significant office down in the Virginia Beach area, and they get to do piracy cases, and so that's a really great district to be the United States Attorney of. I was the U.S. Attorney for the Western District. Now, for those of us who live up here in the D.C. area, every once in a while we'll venture out to the Western District if we run down to Charlottesville or something. But for the most part, we stay here in the Eastern. But the Western District is about 3/5 of our state. It covers Charlottesville, Roanoke, on all the way down into the coal fields in Abingdon, Virginia. And so in 2001, I got a chance. I had clerked for a federal judge in Roanoke, Virginia. And my political mentor, John Warner, who was a senior senator at the time here in the Commonwealth, appointed me to be the United States Attorney. I was 36 years old. He called me and said, I'm going to appoint you to be the U.S. Attorney. Don't mess this up. And I was very excited. And so he called, we hung up the phone, and I remember that the phone rang again immediately. So I picked it up. I was in my law office at the time, and it was Senator Warner. And he said, I forgot to tell you something. I was down in the coal fields recently, and somebody mentioned something about a thing called Oxycontin. He goes, when you get on the job, take a look at it, and hung up the phone. And so I said, okay. I was sworn in August of 2001, and about 10 days later, 9/11 happened. And so for those of us who remember that fateful day and that time, the Department of Justice really changed. And of course, in the Western District, we have a lot of public universities, a lot of foreign students, and so 9/11 kind of took over a lot of what DOJ did. But it wasn't long after I started, I was down in the coal fields, and I asked if we could have a meeting of the local sheriffs. The Western District has about 130 or so counties, and so we had a lot of sheriffs from down there. It's a breakfast meeting, and I remember, first of all, how you remember things in life. I walked in for this breakfast meeting with all these great sheriffs, and one of the things I remember is the plate of bacon, going, wow, that's a lot of bacon we're going to eat this morning. And at the end, it was all gone, by the way. But we were talking, and it was this drug Oxycontin that dominated the conversation down in far southwest Virginia, that pretty much every drugstore had been robbed. Gun sales had gone up because people were so concerned, a lot of what you talked about. Kids were selling it in their public schools. And I remember leaving that meeting with the echo of John Warner's admonition in my ear saying we should take a look at this. And it was soon after that, in talking to the prosecutors, recognizing they had prosecuted doctors and nurses and street dealers and users, but there was a broader question, how did this happen so quickly? And so it was soon after that we decided to open an investigation of the manufacturer, Purdue Pharma, of Oxycontin, and then in December of 2002, initiated the first subpoena for records to the company, which ultimately led 5 years later to their conviction. And so it's probably not a direct answer to your question about that, but here you are in a little bitty district in the western part of Virginia, and yet with the power of a federal grand jury and some great local prosecutors and investigators, you can take on one of the biggest pharmaceutical companies in the country. So that's what we started.
So if you could just go a little bit more into that story. So
Sure.
They're a drug company and they're producing a drug legally. What was the crime? What did you find?
You know, the investigation revealed the biggest thing about it, like most cases, it was just basic false testimony, right? I mean, if you look at having prosecuted a lot of cases, and now I've been on the other side for about a decade, most criminal cases come down to lies, if you kind of think about it, or deception, particularly in the corporate arena. And that's what this really was. This was a drug that was pretty much pure oxycodone, which is a highly addictive opioid, that had a coating on it, that was time released, but that was about it. And yet it was marketed as if the addicts won't like it, that you won't get a euphoria. You know, most pain medication, if you take it, what does it do? It ramps up, it cuts your pain, and then it ramps down. You got to take it again, and it's up and down. And so for most pain, pain medication, you have to take a lot of it. And there are a lot of side effects of that. And so this drug was promised. It didn't have the peaks and valleys that it would get up and then it would stay up, and it was just time released. That just wasn't true. It didn't do that. It was like every other pain medication. It had peaks and valleys, and yet they were able to and did train their sales force, and there were videotapes of this, to go out and tell doctors that this was different. This was the magic drug, that you could take it and take a lot of it and not be addicted to it. And of course, that was just false. And that's what the company ultimately pled guilty to, what we call misbranding. It's an FDA charge, but basically it's a deceptive practice on how you market your drug. And then the top 3 executives of the company pled guilty to the misdemeanor misbranding as well.
And they lost their jobs because of that.
Right. And the big thing in all of these cases, and you touched on it with Medicare and Medicaid, is the debarment, the suspension debarment. That is the big hammer. Because if a drug company can't be reimbursed through Medicare and Medicaid, in this country, they're not going to survive very long. And so, because there's just not a lot of private out there, most of the drugs that are paid for in the United States are done through the government, particularly for the elderly and then for the poor, which is a lot of the Oxycontin. And so that was the 3 executives who pled guilty. HHS, who controls the suspension debarment, banned them from the industry. I think it went up and down in the court system. Ultimately, it was about 7 or 8 years, but effectively took them out of the industry for the rest of their careers.
We'll talk later about where the company stands
Sure.
on that, though. But Mary,
I just wanted to piggyback on what John's saying. First of all, you know, OxyContin was intended initially for last stages of cancer pain. But combine that with the power of the internet, and people, young, especially adolescents, learned, wow, if we take this OxyContin and chop it up and snort it, or let alone inject it, that they're going to get that massive, powerful opium high all at once. So if you look at the history of addiction, there's usually a baseline in America, and there have been people who have been addicted to Vicodin, or as sort of a baseline set point in America. But when OxyContin hit the country and they learned how to take off that timerless code and get the high all at once, we took addiction and just stuck it on a speedway. And the rates just went climbing upward. And Purdue was well aware of that. I had conversations with them in my office about this very point. They refused to admit it. So I just want to thank you and congratulate you on your work. And I consider myself, first and foremost, a parent advocate. So I told Danielle I probably would blurt this out at some point in time. But as Virginia was battling this, and Hal Rogers and I became co-creators of the Prescription Drug Abuse Caucus in Congress, he was talking about Appalachia. But I came to him and I said, this is not just Appalachia. This isn't just hillbilly heroin. This is in Palm Springs, California. This is in Laguna Beach. And this is in my home. So Purdue, it was worse than just this pill. It was the chopping it up and getting it all at once that really created the epidemic, in my opinion.
Wow, thank you, Mary. So, Chris, around this time, around 2001, what was happening on the policy front? There was this commission and the smiley face. How many of you have been in a medical facility in the last 20 years now, and they ask you, how much is your pain, with the smiley faces, right? What was going on, Chris? How did that happen?
So, well, like, as we all know, most things in life began with good intentions. You have a group of doctors who genuinely thought that they could improve the lives of people living with chronic pain by opening the door to opioids. And that partly came out of the hospice movement in the UK, that came to the US, and on the back of that, they said, well, if we're using high-strength morphine, basically, to ease the last few years of people, last few months of people who are dying of cancer, why can't we kind of use that to treat chronic pain, people living with physically and mentally debilitating chronic pain? And that essentially took off in the late 80s into the 90s. And you have a group of doctors that really pushed this, led by a doctor called Russell Portnoy. And they ran up in the United States against what essentially they regarded as a stigma within the medical profession against prescribing opioids. They considered this an unreasonable fear of addiction. And Portnoy's admitted since that they set out to break that down, and in doing so, essentially they misrepresented the science. They overstated studies which showed a low risk of addiction. These were studies that had been made in very narrow and specific circumstances, and they were extrapolated to say there's this broad, very low risk of becoming hooked on opioids, that these are extremely effective in the long term on the basis of no studies whatsoever, that you can ratchet up the dosage to meet the pain levels without any risk of addiction. They invented the concept of something called pseudo-addiction, which said that if somebody looks like they're addicted, it's actually the pain that is speaking, and you just give them more opioids. And so all of these things were piled in together to promote the idea that these drugs were good, effective, and safe. And the drug companies, never being slow to spot an opportunity, take this and run with it. And in fairness to Portnoy and some of the other doctors, they had added caveats. They had said, look, this needs to be very closely monitored. Doctors need to carefully look out for signs of addiction. The drug companies stripped all of that out, led by Purdue Pharma. And Purdue Pharma is the company we all hear about, and now the Sackler family that owns it. But it's by no means only Purdue Pharma. I've just come from a trial in Oklahoma that's taking place at the moment of Johnson & Johnson, the baby shampoo people. And what's being revealed in that courtroom is they followed exactly the same playbook as Purdue Pharma in lying about these drugs, exactly what John was just describing. And there are plenty of other companies that have done the same thing. Insys, which has just gone out of business or just declared bankruptcy, essentially did something very similar, as well as bribing doctors to prescribe. And so what you see the industry do in the late 90s and early 2000s is that they say we need to change the mindsets of doctors and we need to get these drugs out there being very widely prescribed. And they did this in a number of ways, but one of the most effective was through something called the American Pain Society, which was largely funded by the drug industry. The American Pain Society was promoting the idea of pain as the fifth vital sign, that you could measure pain the same way as you measure your heart rate and your blood pressure, and that doctors should always check for your pain levels. And Purdue Pharma led this, but other parts of the industry were also responsible. They latched on to a body called the Joint Commission, and the Joint Commission licenses hospitals in this country. And without those licenses, hospitals don't get federal funds. They don't get Medicare funds and all of the rest. So they really need those licenses, and they follow Joint Commission edicts very closely. And the industry essentially persuaded the Joint Commission, partly through a financial relationship that benefited the commission, that they should require all doctors in hospital to check every patient for signs of pain. And that's when the smiley faces go up, because pain is entirely subjective. You can't measure it with a meter. And any patient who says that they have pain at level 5 or higher has to be referred for treatment. And what you see at that point is Purdue walks in and says, we will write the training manuals for the doctors, because doctors in America get at best a few days and often only a few hours of training in their first 4 or 5 years in treating pain using opioids. So doctors often are very ill-informed about how to use them, or have been. Purdue Pharma write the manuals. The manuals state a lot of these claims about these drugs being safe, and they can ratchet up the dose, and there's low risk of addiction, essentially push that line, and then those manuals are distributed out to the doctors and to the hospitals. And the doctors in hospitals will tell you that a kind of tyranny developed over the following years, where if you didn't treat a patient's pain, as a doctor, you would find yourself hauled up before an ethics committee. If you didn't prescribe opioids, the insurance companies and the doctors would, and the hospitals would want to know why you weren't using the best method of treating pain. And to ensure that this edict was being followed, the Joint Commission required patient satisfaction surveys of patients for their pain. And as any doctor will tell you, if you have somebody who comes in who has pain and wants pills for it, you can have a 30-minute argument with them about the fact that their pain comes from the fact they're overweight, they eat badly, they need to do exercise, or maybe it's stress, or you can prescribe them the pills. And the former will get you a very low mark on the patient satisfaction survey, and then problems with the hospital management, and the latter will have the patient in and out in 10 minutes, 5 stars on the patient satisfaction survey, the insurance company's happy. And doctor after doctor told me that this pressure just came down, prescribe the pills, get the patients out the door. And that was entirely opened by the industry's influence over the Joint Commission and the promotion of this idea of pain as the fifth vital sign, which they've now retreated from. But that was essentially policy for nearly 20 years.
And so, Chris or Tim, so we're talking about sort of what's happening at the hospital level and doctors, but what was happening up at the FDA, and what was the influence? What is the relationship between industry and the FDA, and what is the reliance on the FDA, like user fees and that?
Well, so it is interesting that the FDA is one of a few agencies that's kind of funded by the people it regulates through sort of user fees, which on one level makes sense. As sort of a free market guy, I want more things to be funded by user fees. I want the metro to be funded by metro riders, highways to be funded by toll payers, and so that's part of the argument. But one of the things I remember being surprised by was noticing how much drug makers would lobby to preserve that. You might assume that they would say, well, no, we shouldn't have to fund this. This should just be out of the general fund. And then you realize that it's about industry, about capture. the idea that regulators become, and sometimes I think the become is overstated, regulators are often the people who care the most about what they do are going to be the regulated. So the patients who are affected by the regulations, we don't have the knowledge or the time to go ahead and have our voices heard. The doctors who deal with what the FDA, or the hospitals who deal with what the FDA hands down, they don't have the knowledge or the time to sort of have their voice heard before the agency. So here you have an agency that is full, again, of well-meaning public servants trying to protect the people and bring them cures and all that stuff. But the voices they're going to hear most, and the people who are paying their paycheck, are the people in industry. That said, that the FDA approved oxycodone is not the sort of thing that I think gets at the heart of the problem. There's lots of dangerous drugs that get approved. It's the subsequent stuff about how it got handled by the industry that I think led to the problem. But
So FDA, by the way, the FDA investigators were a lead agency on the case, coupled with the Virginia State Police, the West Virginia State Police, because it was down in that area. Two great federal prosecutors, Rick Mountcastle, Randy Ramsar. These are two great public servants who really drove the case. But one of the things that's important in drugs is the package insert. This is the written kind of the roadmap for how you can use the particular drug. And so here's what was included in the package insert for OxyContin. See if you can understand this. It says, delayed absorption as provided by OxyContin is believed to reduce the abuse liability of a drug. I'm not sure what that means, but it enabled, at least the company felt like it could green light to go to a physician and say, the addicts won't like it. There's no abuse here. You can feel free, Dr. Jones, to prescribe this in great quantities because the abuse liability is less because of the delayed absorption. Now that just turned out not to be the case. It was just not true. But then they took that, kind of, as we described it, I think in the facts is called nonsensical language. I'm not sure that's the best legal term, but we came over that. And then they were able to train their sales force to go out and remember, this is so personal, right? A salesperson from a company will knock on a doctor's office and sit there for several hours, and then he or she will get their shot. And when they sit across from that physician, they tell them, you can prescribe this to your pain patients. Okay, the addicts don't like it, so if it gets out on the street, you don't have to worry about it. And it doesn't have the peaks and valleys and all the things we talked about, which was patently false. It just wasn't true about this particular drug. One of the best pieces of evidence we were able to get are the training videos. Now, the videos themselves have never been made public. The transcripts, the court would not allow the videos themselves to be released, but he allowed the transcripts to be released on the day of the plea. And so they videotaped their training, and so they would have a real salesperson sit down with a fake doctor and practice, and they would videotape it and then critique it. And the videotapes laid out the corporate culture, which we believed part of the plea was corrupt in the sense that they were training them to falsify the information about the drug to doctors. And that's how they trained them up, and then they went in there, and that's exactly what they did, and it just spread like wildfire throughout the country.
So John, but how did that language get approved? Who decided that that could be?
Ultimately, the package insert is approved by the FDA, and so that's what got in there. Now, there was a black box warning eventually added, but you know, when you have language that can give cover, and I remember in working with the government and the prosecutors and the investigators on the case, this was an issue, right? This was a defense, right? The FDA said we can say this.
Right.
And so we just had to kind of plow through that.
You wanted to add something, Chris?
Well, how that label came about
Yeah.
is actually very indicative of what happened with the FDA and how, at the very least, it dropped the ball. That label came about because Purdue's marketing department went to doctors when OxyContin was first cooked up and said, we've got this really high-strength drug, which you can use over 12 hours, all the things that John's just said. Will you prescribe it? And they said, no, it's very high dosage of opioid. That's going to increase the risk of addiction. This is dreadful. We're not prescribing this. And the marketing department went back to to the management of Purdue, Dr. Richard Sackler and others, and said, listen, doctors won't prescribe this drug. We need to change what we say about it. And so they cooked up the idea that it was not only more effective, but it was safer because it was long release. They then go to the FDA and make these claims. And the key thing here is that the FDA doesn't check. It doesn't ask for any studies, particularly about the long-term effects of the use of opioids. And one of the reasons they don't is that OxyContin's made of oxycodone, and oxycodone is a generic drug that's been around forever. So it doesn't require, if you want to make a new pill from oxycodone, you don't require additional studies. Except there was a young researcher who initially handled it and said, but they're making claims for the slow release, so we should require studies. Purdue appealed to the person above her head, a doctor called Curtis Wright, and he says, no, I'm going to allow this to go through. And that's how the label that was essentially written by the marketing department of Purdue Pharma ends up being approved by the FDA. And you can make of this what you will. 2 years later, Curtis Wright was working for Purdue Pharma. And that label, they then, as John just said, they took out and said, look, the FDA approves this. Look, the FDA said all these things. Right. But actually, it was Purdue Pharma saying it and the FDA rubber stamping it.
Well, and that, I just want to add, and I'd like to hear about John's experience with dealing with this, but a lot of times this is one of the dangers of having regulation in this sort of environment, is that it can be just both a defense vis-a-vis legally. Well, we met with every prescribed regulation, so you can't come after us. And the more that things are regulated, the more that that's a defense. So legally, but then also to the doctors and to the patients to say, okay, well, this could be a little dangerous, but if the FDA is okay with it, then we're okay with it. So in other words, the heavier hand creates this false sense of security if it's not actually able to provide that level of safety. But I mean, that was a defense they were giving, right? That, yeah.
So I just want to get back to this user fee thing, because I think that's a really interesting element, and it actually goes back to what Mr. Gray was talking about in his remarks, where the CFPB is sort of outside the political realm because it isn't funded through congressional appropriations. That's more than half of the FDA's budget is in the same way, right? And part of what we worry about it in our organization with regards to that relationship is it's not just that the FDA is getting funding from the drug companies. They literally every 5 years sit down at a table and negotiate, the representatives of the FDA and the representatives of industry, and it's a negotiation on how much the industry will be paying to the agency, the regulator, with regards to what the regulator will be allowed to do as a regulator. They actually are talking about that. And then the Congress just approves up or down this, I think it's called PDUFA, every 5 years. So Mary, I don't know if that came through while you were in Congress, because it's every 5 years. Can you talk a little bit, I mean, I think there's a really significant question here. Why is this, I hear your point that, it's good not to have everything paid by tax dollars. I totally get that. But this, I think, is potentially one of those corrupting influences. And I just wanted to hear your thoughts, maybe, Mary, on that.
PDUFA is wildly appreciated by members of Congress. I think the public weighed in a long time ago that they do not like to have a lengthy delay of bringing drugs to the market. Mm-hmm. There are a whole bunch of issues that factor into that, but just the delay of the bureaucracy being underfunded wasn't good enough for members of Congress to sit there and explain, well, you're underfunded. The question for me on pharmaceutical funding of the FDA really isn't the big part of the opioid epidemic in my mind. Mm-hmm. And I think part D, too. I was there for that vote. Mm-hmm. Remember it really well. Part D, which was the Medicare expansion of drug coverage for seniors, was extremely popular in Congress. Well, not popular enough. Yeah. We had to keep the vote open long enough. But back home with our constituencies, my district was Palm Springs, and Hemet and the Inland Empire of California, very, very large retirement area. It was very popular. And people, there was so much of an effort, and that's a conversation for another day, but the grassroots pressure that was alive and well in my congressional district to support Part D. I mean, for me to have voted against it would have been really difficult to explain to the seniors in a community like Hemet, where probably income level, very few who are living other than Medicare, Social Security check to Social Security check. So that aside, there are other issues that if you look at the FDA, there was a reluctance almost to prove a negative. For those of us who were, I held congressional hearings. By the way, I chaired the Commerce, Manufacturing, and Trade Subcommittee. And I held the hearings in my committee about the opioid epidemic because the Health Subcommittee wouldn't hold them.
Why?
That's probably the very reason we're all here today.
Okay.
But we had them, Chairman Fred Upton allowed me to have them in my subcommittee. But, whether the FDA was sort of, and I think Chris writes about it in his book. And by the way, I think Chris's book is one of the top 4 books in the decade over on this topic. I think I'd put you up there with, and I'm in his book, so I really like it a lot. But I think, Dope Sick, Hillbilly Elegy, and Beautiful Boy. I think those are all pivotal books in our movement. But FDA, we met with Peggy, Director Hamburg, and Administrator Hamburg, and she was, or whatever her title was, she was a deer in the headlights. When we pushed her, and I think he writes about it in the book, that she wishes she had done more, but when we brought this problem to her and asked her for relabeling, for getting tougher on the prescribing, it's just they were busy really in research and innovation, not in what they thought probably was a DEA problem. But in my committee hearings in the commerce, manufacturing, and trade space, and I keep these transcripts actually on my iPad and I refer to them often. But I remember asking a pharmacist who we had called to testify what the difference was between heroin and OxyContin. And his response to me was something like, I just retired recently. I'm probably not qualified to answer that.
Wow.
Yeah.
Just afraid to say it?
No, they're obfuscating. They didn't want to answer it. Yes, afraid because he didn't want to answer it because
Right.
it was going to stick, his former industry right in the eye. So, so blame the FDA is one thing, but the other thing Chris does in his book is he talks about responsibility around the whole ecosphere of prescribing and pill mills and bad doctors and bad. So it's hard to specifically blame the FDA, and I don't think that it's necessarily helpful to do that.
No, I think we have all kinds of things we can still talk about. So if we could talk a little more about Congress, you already cared deeply about these issues. So you were probably not the target of lobbyists who were trying to persuade you to be on their side, right? But were you seeing your allies, your friends in the Congress? You have the unique view that the rest of us here haven't, of like what's going on when we hear about the kind of lobbying pressures that members of Congress and, of course, potential campaign contributions to.
The lobbying by pharmaceutical manufacturers and distributors is no different than any other industry. If you have jobs in a district, a member's going to care about the numbers of jobs. There are a whole bunch of issues that go into why they care. In this one specifically, first of all, pharma was already mad at me because I had supported rampartation and drug pricing was an issue, and so they didn't like me to begin with. So I was just on the same escalator of just not being their favorite girl. To begin with, but and it's in Chris's book too that Purdue Pharma literally threatened me in my office, not with physical harm, but with political harm. And it was widely reported then, but they had come in and they had hired a former member of Congress to come in and try to persuade me that I was on the wrong path by saying that they were, I don't know, evil might be too harsh a word, maybe not. But they threatened me with defunding the prescription drug monitoring program in the state of Florida if I continued to do my work against and raise the profile about their drug. So,
wow.
Yeah, so there was tons of lobbying going on. I was telling Chris earlier, if you look at the support Purdue specifically gave around my hearings, I, of course, never received any money from Purdue. Yay. At least maybe not as far back as I've looked. I sure hope not. But suddenly they were supporting people around me who could stifle me. Yeah. So.
Wow. John, you experienced some pressure also and threats. Do you want to talk about how at a different agency now, we're not at FDA or Congress, you're at DOJ?
Yeah, it was a little bit different. In the Department of Justice, I had spent most of my professional life there. I had been an assistant U.S. attorney and then pretty much straight to be the United States attorney. And so when we did the case against Purdue, it always makes sense that companies and individuals hire good lawyers, and those good lawyers are advocating for their clients, and that is perfectly right and expected. And now that I'm on the other side, when I have a client, that's what I do. This was a little bit different. The pressure came from within inside the Justice Department. As the story has been told, the night before the plea was to either be accepted or they would be indicted. Got a call from a senior guy at the Department of Justice that said we should slow down the case. And I remember it was late in the evening, I was at home. I had my 2 little kids running around, and I was on the phone, and I just asked him if he was calling on behalf of the Deputy Attorney General, and he said no, and so I told him to go away, and he did. And the case went down that evening. But it's that type of pressure. My name ended up on some firing list a few days later. Fortunately, I wasn't fired. But yeah, I mean, these things are high stakes for companies. Traditionally, DOJ is sealed off from that. The United States attorneys are protected from that and should be. This was a particular case that went a little bit haywire for a little bit of time. But eventually the case worked out, and we think justice was served. So.
And there's no horse head in his bed, so it was a good thing.
And there's I see things slightly differently from the way you're describing sort of the revolving door when it comes to attorneys in this matter. When you're describing a case where Pharma actually also had hired Rudy Giuliani, who had just come off his tremendous success as a mayor right after 9/11, right? And he was then representing Pharma as a former public servant in a way, representing industry. But then the Washington Post, and you should also, in an additional look into these corrupting influences, is a series in the Washington Post and 60 Minutes. And in their case, they found a different company, McKesson, and was the main focus of theirs. But one of their stories was about Cardinal Health, who had invited or had as representing them Jay McGreal, who had been the number 2 in the Clinton administration, DOJ, was now representing them during the Obama administration, and she was calling DOJ to tell them to back off in their investigations of the DEA's work. That's another part of this, the influence, undue influence, is the DEA, which we haven't got to yet, but could any of you talk about what's going on there and the sort of, what is their role? We've been talking about the FDA, but is there another example?
There's a guy called Joe Radicisi who headed the diversion division, which is essentially the kind of law enforcement division of the DEA in terms of monitoring whether drug companies are fulfilling their legal responsibilities as they distribute drugs around the country. And it became very clear to him quite early on that the big distributors like Cardinal and McKesson weren't fulfilling a legal obligation to report suspicious orders of drugs that they were delivering. And so they're pouring very, very large numbers of drugs into small towns in West Virginia, for instance. I mean, literally millions of pills a year into these places that, 2,000 to 3,000 people have got 3 pharmacies. And the law says very clearly that if a drug company sees something unusual like that, it has to not only report it to the DEA, but suspend deliveries. And there's a place called Tug Valley Pharmacy, which is in this tiny town I write about in the book, called Williamson, West Virginia. And essentially the cutoff limit for reporting is about 8,000 pills a month if they were delivered. And at one point, this pharmacy was getting 80,000 pills a day. So you get the idea. The drug companies were not reporting this. So Radicisi gets them in one by one and says, look, you've got to shape up and start reporting, and otherwise we're going to go after you. And they all nod and say yes, and they go away, and then they don't do anything, thinking, oh, he's just giving us, the usual formal warning and we can carry on. So then he moves to prosecute them, to hold them to account. And he's got various tools the DEA can use to do that. But firstly, he goes for prosecution, and essentially they intervene. They use their influence within the Justice Department to slow that down. He finds suddenly he's getting pressure from people like the Deputy Attorney General and others to negotiate with the drug companies. And he says, well, I've been trying to negotiate with them now for quite a long time, and they won't do as they're told. They won't do what they're supposed to do. And the drug companies, the drug distributors, their argument was, it's not for us to police these drugs, we're just delivery boys. And his response was, well, in that case, why don't we just get FedEx to do it? Because you're making very large amounts of money out of delivering prescription drugs, and you essentially have a monopoly between you, and therefore that comes with responsibilities. And as you see things unfold, the more he tries to push them into fulfilling their legal responsibilities, the more he comes under political pressure. And eventually it comes down to the point where he uses powers that the DEA have to block deliveries. In this case, it was to CVS in Florida, I think. Yeah. And the response to that is fascinating because the drug companies, having been unable to stop him, then go to Congress. And essentially, they get Congress to pass the first piece of legislation that actually directly addresses the drug crisis, the opioid epidemic, and that is to take away the DEA's power, or to greatly diminish the DEA's power to block deliveries by the distributors to pharmacies. And that's the first time the drug industry, and one of the members of Congress behind that is Marsha Blackburn, and Marsha Blackburn was, funnily enough, getting some big donations from Purdue Pharma at that point. So that you can see within the DEA, there was this, even where you had an element of it was really trying to enforce the law, there was this enormous political pressure, and then when that finally didn't work, they simply go to Congress.
And then I think related to the point that Tim has made, that is an office where there's also a huge revolving door, right? You have
Yes.
heroes who are trying to do the right thing, but then also people who are getting hired out to teach the companies how to get away without getting caught.
And again, in the Washington Post series, a DOJ official said, yes, the guy who basically wrote the bill was this former Cardinal Health, this former DEA counsel who then landed at Cardinal Health as the chief regulatory counsel.
John, you wanted to say?
Just speaking of Mr. Ranazizi, so we had a different experience when we first started this case, our case back in 2002. We couldn't get the DEA interested, particularly Joe. And so we were able to build the case with FDA investigators, an IRS agent. Never underestimate an IRS agent. They can always find the money. And we then used Virginia State Police and West Virginia State Police. And we had these folks who you wouldn't traditionally think of being investigators sitting behind computers doing word searches looking for evidence in these big databases. And so I do remember before the case became public, we went and briefed the DEA just to let them know what we were doing, and they seemed very surprised that this was going to come down and that they had agreed to plead guilty. So I think they eventually got on board here and came along, but it took a while to get them going.
I was just going to say that there was something kind of bigger going on that was influencing all of these things at this time, which was that after it became apparent that there was a problem, particularly with OxyContin, but to be honest, with opioids in general being prescribed in ever larger numbers, the drug industry realized that they needed to change the discussion away from addiction and death. And in the early 2000s, you see a very public and sharp turn in the discussion where they separate out those they call legitimate pain patients who deserve these pills from the people who become addicted and overdose. And they call them the abusers. And they say the abusers mustn't be allowed, a few abusers mustn't be allowed to take the drugs away from this very large number of people who need them. Now, the fact that frequently, particularly early on, people who became addicted were those who were following their prescriptions was completely ignored. And they created the idea that there was this epidemic of untreated pain, and we must keep the doors to mass prescribing open. And they had this push, something called a balanced approach, which is interesting, exactly what the smoking industry had done 30 years earlier. And it was all about demonizing people who became addicted and overdosed, and painting a picture of a desperate need for these drugs. And you see that thread through everything. So when you're talking about the FDA, it's not just that the division of the FDA that approves opioids gets 70% of its money from the drug industry, it's that it buys them a hearing. So the mentality took hold within that division of the FDA as we mustn't do anything that takes away the drugs from the people that need them. And if you look at the congressional record, particularly through the mid-2000s when Hal Rogers was trying to get things changed, you see in hearing after hearing, the industry is there saying, we must keep the door open, we mustn't take the pills away from the legitimate pain patients. And they were essentially doing the same thing within the DEA. The DEA mustn't do anything that, yes, they can go after the criminal addicts, but mustn't affect access for the legitimate pain patients. And that narrative held for about a decade. And it's actually being pushed again now in a slightly different form. But, and that was a kind of crucial framing of the whole discussion through all of these agencies and in the political sphere.
Mary, is that also when you were talking in the beginning about the lack of trusted journalism, is part of what you meant by that, how even members of Congress were only sort of hearing one side and what they're reading in the media isn't necessarily giving a whole picture of what's going on?
No, I give members of Congress, they need to do a lot more than just look for one piece of journalism to get their opinions. So I really mean what the public believes and supports. And I wasn't in Congress when the Marino bill passed, but when you think about the Marino bill, and then you recognize, so you had this bill making it tougher on DEA, and then suddenly he's nominated to be head of ONDCP, and that fell apart.
Can you explain what that office is?
Office of National Drug Control Policy, which I'm happy to talk about a little bit later if you want to go into it in greater detail. But that bill, the explanation, the debate was shocking. The members were told, however they got the information, that it's actually made it harder to divert drugs, not
the opposite.
Easier. And I mean, I sat there as a former member watching the floor debate, and then it passed on a voice vote.
Yeah.
And Hal was saying, I could have run down there and tried to throw this thing off, but it was going to pass without, Hal Rogers, even with his voice against. But it was just watching that debate. I've never seen such misinformation about what a bill would actually do. And so that's where I think that the media explaining to constituents, wait a minute, what they're saying on the floor, let's really look at this, let's really look at what it does, and then explain it back home, and then have a member justify their vote. But voice vote, nobody cared, nobody's really looking at the arguments of the debate and calling them on it, and that was really unfortunate.
So one thing that I think some people might ask or wonder, John, is so you were successful. You made Purdue pay, $600 million in your prosecution. And the prosecution was against the parent company. So generally in my work in the defense industry, when the parent company is prosecuted or found to have committed wrongdoing, suspension and debarment applies to their divisions. Right. But what happened in the case of Purdue? Because that doesn't seem to...
And when the case was prosecuted, we made the decision not to end the company, basically. This was a company that made a drug that a lot of people used legitimately. And so it was our view as lawyers, as prosecutors, our job was to address past wrong through the criminal justice system, but that the marketplace would take care of whether or not they survived. And so the $600 million represented basically all the profits for the 5 years for the criminal conduct. The top 3 executives were convicted, and then they were removed from their positions from the industry, basically. For the rest of the time, they paid an additional $34 million. The company was placed under what we call a corporate integrity agreement for 5 years, so it allowed monitoring, inside monitoring, by authorities for another 5 years. But they were not, the company itself was not suspended from being reimbursed through Medicare and Medicaid, so effectively the company could survive and did survive. And so that was a conscious decision on our part. Again, I felt like I was not, as a prosecutor, in a position to bankrupt a company. That was not my role. My role was to address that past harm. And I felt it was the right decision. I still think that prosecutors and the Justice Department can be a very effective tool, but sometimes it can be a blunt instrument, and prosecutors should not be the ones deciding which companies survive and which companies don't.
So I'm going to ask one more question to the whole panel, and then we'll open it up to 15 minutes of Q&A with the audience. So I think we've done a pretty good job of talking about all the different avenues of crony capitalism. So if you, Mary, were back in Congress, or any of you were in a position to change any kind of rule, whether it's in an agency or through the laws, what would you change, looking at everything that we've looked at? We're here, with the American conservatives, so I'm imagining the answer is not more regulation, but I don't know that. So I'd love to get a sense of what do you guys think, what should change? Who wants to go first?
Well, when you look at the studies that predict over the next decade, we'll see another 500,000 Americans die to an overdose death. It's terrifying. And when you recognize that we've lost generations and we've lost children and neighbors and, and parents and you name it, this is the next generation. I'm the grandmother of 2. My grandkids are 4 and 7. And I am terrified to think that within 5 years, they'll be in the age group of being approached with this epidemic, and will it hit them? So what concerns me, and we talked about 9/11 briefly, after 9/11, we reorganized the government. We created the Office of the DNI, Director of National Intelligence. We created, some good things, some bad things. But the one thing we did, we recognized we were not coordinating across the government, and that our responses were very inefficient. So I question why our ONDCP head is no longer cabinet level, and it's barely functioning at all. And so when you think about more Americans dying in the next decade than anything else that we're going to look at, why we're not coordinating the way we did after 9/11, why we're not saying to the head of ONDCP, you are in charge of all of these agencies. Last count, there were over 15 federal agencies or departments or something, at least 15 with their finger in the pie here, and nobody's coordinating them. Under President Obama, actually, in my opinion, very little was done, and you had people sort of, HHS was trying to take the lead, CDC is trying to take the lead. Finally, Dr. Frieden came out and said that it was an epidemic, but there was no coordination amongst all of the agencies. So if I were back in Congress, I would demand that there is a single sort of office of National Director of Intelligence, that there is a supreme person who is coordinating everything, and that we demand that those 500,000 deaths are not acceptable. And we need to do everything we possibly can to get together and make these agencies work and actually be effective. So that's what I would do. I would actually just become the czar of drugs.
There you go. But there's not a drug czar anymore?
There is. There's Jim Carroll over at ONDCP, but every year this White House moves to defund ONDCP, and they believe Office of National Drug Control Policy ought to just be a policy shop. And that it ought to be lowered, but they're not talking about then who they're going to elevate to coordinate this response. And when you look at this White House, when you see, Kellyanne Conway's been doing, the yeoman's work on trying to be the coordinator of all, but it is not a strong, look, it was created, it was known as the drug czar. It's no longer that. And under President Obama, ONDCP turned to the Office of Let's Have Everybody Get In for Recovery, and we dropped the other important parts of the work, like the drug interdiction that has to be done at our borders. I mean, there's a lot of serious work that has to be done, and the only way you're going to do that is you elevate this person and give him or her ultimate command.
So I have a lot of friends in Washington who are sort of full-time libertarians, and one of them once said to me that I'm a libertarian from 9 to 5 and a conservative after hours, which is to say that libertarianism is a right approach, less government is a right approach for the federal government, but that it's not sort of reflecting some ultimate truth, that the real good is something above and beyond, allow me to have my prostitutes and my drugs and my cloning, but that maybe the federal policy almost always ought to be stay out. The counter-arguments to the places where my libertarianism is very thin will have to do with children that, these are not rational creatures. I have more of these irrational creatures in my house than most people, and laissez-faire doesn't work on that level. But also addiction, because a philosophy of freedom applies to free people, and addicts are not free in the same sense that we think of most adults, at least in that regard. I've got my coffee addiction, and it is a way in which I am less free. And my coffee addiction is 1/1,000,000th the severity of a drug addiction, particularly an opioid addiction. So it's a place where, again, you can't just simply have, however libertarian you are, and I think I'm fairly libertarian, you can't take that simple mindset to questions of addiction. But the other thing I would throw in is when people ask me what say we should regulate something, again, I'll say let's start by regulating the government. Let's start by regulating the officials. And I think that the ethics, the conflicts of interest, the revolving door problems at the various government agencies are part of the problem. And if we can control that, we can do better. But then finally, there's been an interesting thing here. We talk about the court system. We talk about Congress. We talk about the executive branch. Any one of them can be corrupt and do bad things. The idea of the Constitution is for them to interact, have different roles, fill in where others don't, and then provide oversight. Congress, especially now that they're not passing laws, then maybe they ought to get more, and I'm not just saying this to butter you up, but maybe they ought to get more in the business of looking at the agencies and saying, what are you doing? Why aren't you doing more? Sure, some of these congressmen in their oversight might be speaking on behalf of just their big employers or just their big donors, but only that courts, executive, and Congress sort of applying pressure to one another, that's going to produce the best outcome. Congress has largely given up the idea of overseeing the agencies because you can't win re-election on that. You can't raise money on that. And frankly, it's kind of hard work and boring.
Yeah. Not boring, super fun. But you would potentially support legislation that would increase rules on revolving door?
Absolutely. Regulate the regulators and the lawmakers.
Chris, what do you say?
Take corporate money out of writing medical policy, by far. I mean, unless you think it's, the drug companies, opioid makers are definitely on the back foot right now. You've got a trial down in Oklahoma of Johnson & Johnson, as I said. There's over 2,000 lawsuits of various forms going on against the drug makers, the drug distributors, the pharmacies, and clearly they are not able to continue to pursue the policies that they did in the same way. But they continue to work hard to keep the door to prescribing open as wide as possible. And the best evidence of that right now is that after Tom Frieden declared within the CDC, as CDC commissioner said that there was an epidemic in this country, he said about cooking up guidelines for doctors on what level of drugs they should prescribe. And the CDC guidelines came out a couple of years ago, and they said two important things. One was don't begin with opioids for treatment of chronic pain unless you really think it's necessary. And if you do go to them, limit time and dosage. And it set specific recommendations, and they were only recommendations, 3 to 5 days, upper limits of 50 or 90 milligrams. And the industry pushed back quite hard, and it's got Congress to appoint, essentially, create a task force to oversee these CDC guidelines. And the task force was then stuffed with specialists who happen to be in the pay of the industry. I think 10 of the 15 are directly taking money from the opioid makers, and they have recently issued their their recommendations, and it is to scrap the recommended limits on dosage and on length of prescribing, and also saying that there's no evidence that these drugs don't work long term. But actually, there's no evidence that they do. And as you said, they're being asked to prove a negative. Now, Tom Frieden's furious about this. He says this is the industry at work. And it is. So they're still out there. They're still pushing to diminish what action is taking place. And that, to be honest, is a direct result of corporate money influencing what should be just sane medical policy. And is in pretty much any other country. There was a study, just to finish, there was a study that came out recently in the Journal of the American Medical Association, which shows that dentists in America, prescribe about a third of all the opioids in the country. Dentists in America prescribe at 70 times the rate of dentists in England and Wales, 70. And 1 in 10 of those dentists prescribes, or 1 of 10 of those prescriptions is for high-strength opioids like OxyContin. No dentist in England or Wales ever prescribes those for routine dental surgery. And although that's fallen a bit, it hasn't fallen that much. And you know, there's a separate thing going on now, which is a consequence of the earlier prescribing to do with fentanyl and heroin. But if you're not going to create another wave of people who become addicted to these drugs and then turn to the street drugs, you need to rein in the prescribing.
John, if you we just have a few seconds.
Yeah, I mean, I look at this from the I guess the eyes of a former prosecutor. What happened with OxyContin in the 1990s in the United States happened because of a lie. Right? A company developed a product and then lied about it, and lied about it to those who could prescribe it in massive amounts, and they did. And it got into the bloodstream of the United States, and we're here sitting 20 years later still talking about this epidemic because of that lie. The second thing is that the lie was told because of the money that could be made from the lie. If you kind of look at most criminal white-collar cases, that's really its core. Right? Walk through a courthouse and anywhere in the United States, and you'll see underlying a lot of those cases, Madoff, all the big ones, it's a lie. And people tell lies to make a lot of money. And so when you talk about going forward, at least from a Department of Justice, it just has to remain vigilant and be looking for these kinds of pieces of evidence to address. And it's out there. The Massachusetts Attorney General just returned this massive complaint against Purdue, some of the family members. But go read that complaint, and you will see what happened. Remember, in 2007, when they were convicted, they were placed under a corporate integrity agreement for 5 years. That means they had an inside monitor inside Purdue that was supposed to monitor their activity. Okay? You will see that in 2009, according to the complaint, they were right back at it. So where was the monitor? Who was monitoring? Now, the Bush administration left, the Obama administration come in. What did they do? You know, where was their focus in the 8 years? And so I just think the department, these federal law enforcement agencies, they have to remain vigilant to be on the lookout for these next things, because the money is out there, and where there's that kind of money, there will be those, a small number, but there will be those who decide that deception is the way to that money, and they will take it, and these federal agencies and law enforcement agencies will have to be on the lookout and prepared to address it.
Okay, thank you, John. Kelly, do you want to go ahead with some questions?
We only have a few moments, so I just ask you respectfully to make your comments in the form of a question, and maybe if we get through rapid fire, we can get more questions in, because I know there are a lot of people that are interested in talking about this and asking questions. So just please state where you're from and your question. Thank you.
I'm David Gronoski. I'm from Florida. I had a question regarding you'd mentioned Purdue, and there was a revolving door situation where the FDA rubber stamped these claims that were dubious about the effects of this OxyContin drug and its timed release. So my question is, if there was no FDA and you had a private organization tasked with the responsibility of being a third party to make sure there's some accountability between producers and consumers, would they be held liable for what the FDA did and there's no liability at all?
Seems like a legal question to me.
Yeah, we're all looking at John.
I'm not sure I could follow that exactly. Federal agencies have certain immunities, and so I think that they're, I hate to give legal advice on something that is probably not my area's expertise, So let me just defer on that. But I understand your question. It's a good question.
Yes, a private regulator would have been held liable for what the FDA's done. Yep.
But I wonder if we had the revolving door rules that Tim and I would like to have, then there'd be individuals who would be held accountable if they were going through the revolving door legally.
Also, I mean, would a private regulator be any less open to the same influences we were talking about?
No, it's just that there would be.
Themselves as a consumer, as a third-party protector, and then they were colluding with the people they're supposed to be protecting the consumer from, and you put out of business, either by competition or through liability through court. But the FDA is shielded from that. There's no financial, damages or liabilities that in the actors would have to pay up for the FDA.
I have a question. Thank you. I'm John Utley with the American Conservative. Can you widen this a little bit about the general power of the pharmaceutical industry to order doctors to make prescriptions for all sorts of things? And I come back my own case. I'm very old and very healthy without taking medicines. But I was tested and I had low cholesterol, and then the doctor prescribed a statin for me. And I said, why are you prescribing this? I don't have the cholesterol. And she said, I have to. And I've heard later that the pharmaceutical industry determines what treatment is necessary for what illness, and doctors can't deviate or risk being sued, etc. Is that so?
Well, the doctors set their own standards. What is the role of different industries, whether it's drug makers, device makers, et cetera, in influencing their standards is one thing. And lawyers who sue doctors for malpractice also help set those standards. So, I mean, there's a case of defense of medicine. There's no direct pipeline through which drug makers get to set the doctor's standards, but certainly there is a practice of doctors saying, there's a safe way to do it, where I know I won't get sued, or there's a safe, and that can lead to some of these problems.
And the insurance companies have influence too, or particularly pressing doctors to go down the easiest path or the cheapest path. It doesn't mean to say they necessarily do it, but doctors will tell you that the effect can be to limit their freedom of movement, but it's still the doctor's decision.
But early on when we started this work, years and years and years ago, there wasn't a single medical association, whether it was the county, state, or federal level, including the AMA, who came, said, you know what, you're onto something, let's work together. I mean, we had headwinds everywhere. I mean, Hal Rogers and I were really sort of lone voices, and then as more and more overdose deaths were happening around the country, we were getting more and more of our colleagues on board into caucuses, but we were fighting everybody, not just pharma. We're fighting the AMA, you name it, and every subspecialty as well. And I completely understand that I don't believe doctors should be told by Congress how to be doctors. I think that's a mistake. But when Congress says, wait a minute, there's a huge problem on the horizon, can we talk? It'd be nice if they had come to the table at least.
Mm-hmm. Also, I think, so one of the things that's coming out at this trial of Johnson & Johnson in Oklahoma is the doctors have continuing medical education. And one of the things that's been revealed at that is the degree to which the continuing medical education by supposedly independent educators of doctors was funded by Johnson & Johnson directly. And there have been these internal memos which have been revealed in court, which show that the marketing department saw the continuing medical education as a means of promoting the drugs. Mm-hmm. So, and Dr. Russell Portnoy, who's on the stand testifying now about the influence of the drug companies on this and how they took studies and they stripped out all the cautions and highlighted things that suited their ability to sell drugs, or they only funded studies that were good for them, he was co-chair of one of these continuing medical education bodies, and he was shocked to discover, to be presented in court with these memos saying, let's use this body to promote this drug to doctors because he thought it was genuinely independent education. But looking at it, he said he could see how it was used to shape how doctors think. So I think it's more that than any kind of direct. And it is quite shocking that doctors frequently didn't have any real training, as I said earlier. And one of the things that they tried to get through Congress was doctors need training. And that was one of the things that they fought. Yeah, they didn't want doctors to have independent training on these drugs. They wanted them to get the information from the manufacturers. And that's not just Purdue, that's Johnson & Johnson, a whole lot of companies wrote this.
We have time for 2 very quick questions.
Hi, Jacob James Rich from Reason Foundation. I think the foundation of everything that was said today was built on the idea that prescribing and distribution in the opioid industry, putting out more pain medication caused more addiction. So I want to quickly challenge that real quick. 90 million people in the United States are prescribed opioids. Peer-reviewed research shows that over 99% of those people have no problem with addiction. If you look at SAMHSA addiction rates for illicit drug use, that's not marijuana, it's been stable since 2002. Pain reliever abuse rates, stable since 2002. We have increasing opioid prescribing until 2012, gradual increase in opioid deaths until that time, and then after 2012, we cut prescribing rates in half, and we've had over a doubling of the death rate caused by opioids. So why is this a phenomenon caused by the pharmaceutical industry when it looks like, to me, it's more of making drugs on the street more dangerous for consumers and the quality of drugs and the potency of drugs going up because of enforcement actions?
Does anyone have a reaction?
Well, and to back up some of the, black markets are going to be more dangerous. And there has been a massive spike in deaths. And so that, I mean,
There's nothing gradual about it.
but the gradual, but the question, and I want to sort of bounce this question because I think it's a very good one. If we're having more enforcement in the last few years, not an increase in prescribing of them, and a lot more deaths, then that's an argument that what's killing people is the black market in these drugs. What's dramatically increasing the death rate, I should say, is the black market in these drugs rather than sort of their prescribing. Is that not true?
I think a lot of what you're seeing today is the fentanyl, which is coming in, I think, from China. It's a high concentration. I think some of the heroin that you're now seeing trafficked in the United States is a much higher concentration. And so certainly those are impacting. I think the book, Beth Macy's book, Dope Stick, kind of talks historically. I don't know if you've studied that, but it talks kind of gives a pattern. Some of this stuff goes back to the Civil War and the morphine that was given to the troops after they were wounded. But that doesn't change the fact that if you look at the real explosion of the use and the abuse of these opioids, it really started in the 1990s with the false statements made by Purdue to physicians down in these rural communities, and then it spread throughout the United States. I just don't think that was kind of the lighting of the match in many of these communities. I believe it was in 2012 they changed the drug that made it much more difficult to crush it up and use it. But these folks were addicted at that point, and then they changed to some of these other things that were equally dangerous or more dangerous. So I wasn't sure exactly your point there, but I don't think it changes the fact. You should go back and read the 16 pages of facts that Purdue admitted to in 2007 when they pled guilty. And those pages, those facts, I mean, it's not contested, right? This is what they admitted to, really lay out historically the deception that the company undertook to spread that drug throughout those communities.
Chris, did you?
You also find that a lot of people would challenge your claim that 99% of people don't have a problem. I think the problem comes in many forms. It's not just deaths and overdoses. I think there are people who are dependent on these drugs, and many of them came at that through following prescriptions. And I mean, you can see the graph of the rise in prescriptions and the rise in overdoses. And if you doubt that, you then have to look at other countries and say, well, why doesn't Europe have this problem? Why Britain has a heroin overdose rate of 2,000 people a year, compared to what the United States now. I think the latest figure was 68,000 opioid deaths. And so I think, you'd have to deny the evidence before you, which is that there's been this huge rise in prescribing. There's a huge rise in addiction and overdosing as a result. And as John's just said, once you start to rein in both the prescribing and the access to OxyContin, then people do start to look elsewhere. And one of the reasons for the rise in fentanyl is it's such a dangerous and unstable thing. But it doesn't mean to say that this wasn't caused by prescribing and it's just an illegal drug problem.
All right, I think we actually have
We have to stop it there, but thank you so much for coming out, and thank you for bringing up all of these salient issues. I wish we had more time to talk about them, but we don't. But